Leah is a fictional character, but what they went through is happening across Yorkshire and the Humber today. This is their story. This is about NHS workforce planning in one of the most deprived constituencies in England, where nursing training places are rationed while hospital wards face chronic shortages. It is the story of someone who wanted to become a nurse but found the door closed by Treasury spending limits that treat training healthcare workers as an unaffordable luxury rather than essential infrastructure. Here is Leah.
I am Leah, 26, from Beeston. My mum is a teaching assistant, my dad works in a warehouse, and my gran taught me that when someone is hurting, you do not look away. When she spent months on a trolley in A&E watching nurses run themselves ragged because there were never enough of them, I knew what I wanted to do with my life. I wanted to be one of those nurses. I worked nights at a care home while doing my A-levels at evening classes, saving every penny. My mum still keeps my Leeds Beckett acceptance letter on the fridge, next to a photo of Gran holding me when I was 3. She was so proud. We all were. I had met every requirement for the nursing program. I had passed the interview. I was ready. Then Health Education England told the university to cut 40% of their nursing training places. There's no funding, the admissions team explained when they called me in March 2022. They sounded genuinely sorry. We know you've worked so hard to get here, but the Treasury has imposed spending limits. We simply cannot afford to run the full program. I accepted that. It sounded reasonable. Everyone was tightening their belts. I would try again next year. I spent 2022 working extra shifts at the care home, watching residents wait hours for district nurses who never came because there weren't enough of them. I walked past the nursing building at Leeds Beckett every day on my way to my retail job. The simulation labs were dark. The hospital beds and IV stands sat unused behind locked doors, gathering dust. In 2023, I applied again. This time, I got as far as the interview before they delivered the same message. The budget has been cut, they said. We understand your frustration, but there is simply no money for additional training places. I decided to try a different route. If the university couldn't help me, maybe the NHS could. I contacted Leeds Teaching Hospitals NHS Trust directly. They had 200 nursing vacancies, they told me. They were desperate for trained staff, but they couldn't sponsor training places either. The funding model doesn't allow it, the HR manager explained. Health Education England controls the purse strings, and their budget has been capped by Westminster. That was when I started to notice the contradiction. Every day, I walked past those empty simulation labs at Leeds Beckett. The equipment was there. The lecturers were there. I knew this because I had spoken to them during my interviews. Professor Sarah Chen had shown me the state-of-the-art mannequins they used to teach clinical skills. Dr. James Walsh had explained how they simulated emergency scenarios. They were ready to teach. The beds, the monitors, the IV pumps, all sitting idle. I also knew the people who wanted to learn. In the care home where I worked, 3 of my colleagues had applied for nursing courses and been turned away. Sarah from Armley had all her GCSEs and 2 years of care experience. Marcus from Holbeck had been a paramedic in the army. Priya from Beeston had a biochemistry degree. We would meet in the break room and talk about what we would do if we ever got the chance to train properly. The resources existed, the people existed, the need existed. So what exactly was it that there was no money for? The government that prints the pounds and mints the coins was telling us it could not find enough of them to connect willing students to empty classrooms, to link experienced care workers to hospital wards that were crying out for staff. It made no sense. I started paying closer attention to how this excuse was used. Every time someone said there's no funding, they made it sound like a law of physics, as though training nurses was like trying to build a bridge without steel or grow crops without soil. But the steel was there, the soil was there, The only thing missing was permission. I began to understand that the limit was never the money. The government that issues the currency had chosen not to spend enough of it into the places where people and needs existed side by side. That was not an accounting problem. That was a political decision dressed up as financial impossibility. The Treasury that sets Health Education England's budget could have chosen differently. They could have funded the training places. They could have connected the people who wanted to learn to the teachers who wanted to teach them. They chose not to. Then they blamed the shortage on circumstances beyond their control. I hear the excuse differently now. When someone tells me there is no funding for nurse training, I know they mean the government has decided there should be no funding. When they say we cannot afford it, I know they mean the government that creates the currency has chosen not to create enough of it for this purpose. I am still here, still working at the care home, still watching residents wait for nurses who will never come because they were never trained. I am still walking past those empty simulation labs, still seeing the equipment that could be teaching people right now. I understand something I did not understand when I started this journey. The question was never whether the money existed. The government issues the pound. Money is what it creates when it spends. The question was whether the people existed, whether the skills could be taught, whether the materials were available. They were, all of them. The excuse was not a fact. It was a choice wrapped in the language of impossibility. It is the same logic as a household saying, "We cannot afford it." Except a household does not print its own currency. The government does. The limit was never the money. The limit was the willingness to spend it where it was needed. What happened to me was not bad luck. It was not the inevitable result of scarce resources. It was the predictable outcome of a system that treats public investment as a burden rather than as the means by which trained people reach the places that need them. And I know this is not just my story. This is happening in every constituency where people want to work and institutions need workers, while someone in Westminster says the cupboard is bare. The cupboard is only bare because someone decided to keep it that way.
What Leah experienced has a name: fake experts. This technique works by citing supposed authorities who treat the household budget myth as self-evident truth. In the 1950s, tobacco companies hired scientists to say smoking was safe. These weren't independent researchers, but paid advocates presenting industry-friendly conclusions as objective expertise. The same pattern appears in Leah's story. When Health Education England cut nursing places, they cited, "Economists say we cannot spend more on health without causing inflation." But which economists? The profession is divided. Many macroeconomists argue the binding constraint is real capacity, not currency. Economists say without naming them is an appeal to unnamed authority. The fake experts technique creates artificial consensus around the household budget myth. They select economists who support spending cuts, ignore those who support investment, and present one side of a contested debate as settled science. They never mention that the UK government issues its own currency, that spending is how it deploys resources, or that the real constraint is people and materials, not pounds. In Leah's case, the resources existed. The simulation labs existed. The willing students existed. The decision not to connect them was political, not financial. The expertise cited to justify that decision was not neutral economics, but ideological preference dressed as technical necessity. Leeds South ranks 13 out of 543 English constituencies in the English Indices of Deprivation 2025 published by MHCLG. The constituency has 171 registered charities according to the Charity Commission Register for England and Wales. Total grants received were £8.1 million according to 360 Giving Grant NAV. All sources are published at blockedbritain.co.uk. Blocked Britain tells the stories of people whose lives are shaped by the gap between what Britain needs and what its institutions choose to provide. Every character is fictional. Every situation is drawn from official statistics. Produced by Blocked Britain.